Healthcare is the hot-button topic of the day, and I've been seeing some arguments and numbers going around quite frequently, and some other arguments and numbers not brought up at all, despite how relevant they are to the subject. While I will be arguing against the government healthcare in general, I will be specifically addressing some of the arguments stated in favor of government healthcare in the video Newsish posted on the subject. If you haven't already watched it, I highly suggest you do. It's a well-made video despite the flaws I believe its case has. The main premise that his video relies on is a comparison between international levels of life expectancy contrasted with measurements of healthcare spending relative to a state's GDP. His main thesis can be summed up as, it is desirable for your country to have a low healthcare costs while having a long life expectancy. The only advanced nation without government healthcare has neither low healthcare costs nor long life expectancy. Therefore, having government healthcare is desirable. It is my intention to refute the assertion that it has been government healthcare systems that have caused other countries to have higher life expectancy and lower healthcare costs. Furthermore, I will attempt to prove that a U.S. nationalized healthcare system will only serve to increase costs further, and that in the long run it may even lower the life expectancy we might have gained otherwise. First, we should look at international life expectancies and percentages of GDPs that are dedicated to healthcare. If we take a look at this graph, comparing the countries with the top 10 life expectancy averages compared to the percentage amounts of GDP dedicated to healthcare, we see that the less a country spends on healthcare, the longer its citizens tend to live. Now, it would be ridiculous to assume that the less money spent on healthcare would actually increase life expectancy, so what we can infer from this graph is that the countries with the highest life expectancies have such because of factors other than healthcare that affect the health of the citizenry, and that those other factors determine to a large degree how much spending on healthcare is necessary. Such factors could be smoking, drug abuse, overeating, or something along those lines. To determine what might be a large factor of our health condition, let's take a look at the leading causes of death in the U.S. The top 3 causes of death in the U.S. according to the Center for Disease Control and Prevention are heart disease, cancer, and stroke. Out of these 3 factors, cancer is for the most part accidental and unpreventable. Heart disease and stroke, however, are both attributable to overeating and obesity. Therefore, we can determine that obesity is a major factor affecting U.S. life expectancy. If we look at the population that has the longest life expectancy in Okinawa, Japan, we find a population that eats hardly any meat, and usually only seafood if they do eat meat. And obesity is virtually non-existent. A conclusion could be made that obesity and overeating are major factors in life expectancy, and quite possibly be the most important factor in advanced nations. Let's test that theory by looking at obesity rates for the Organization for Economic Cooperation in Development Countries, which you can see here. And now with the corresponding life expectancies of the countries in this graph. As you can see, there is a definite trend pointing out how obesity erodes life expectancy numbers. Some further information that can be garnered from this graph is that those countries that are significantly above the trend line have a higher than expected life expectancy for their level of obesity, and those significantly lower than the trend line have a low life expectancy than expected from their level of obesity. By an extraordinary amount, one country stands above all the rest in providing its citizens a much higher life expectancy than you would have expected given its exceptionally high level of obesity. In fact, with that level of obesity, if it had only average healthcare, it would have such a low life expectancy. It would be somewhere off the left side of the screen. You can probably guess what country that is. It's the United States. So, we have learned that the biggest contributor to life expectancy in advanced nations is not a better healthcare system, but instead having low levels of obesity. We have also learned that the U.S.'s healthcare system is doing exceptionally well in the life expectancy game given its overwhelming disadvantage, and that it's the fattest nation on earth. Since we can tell the U.S. is doing so well, as it was so much higher above the trend line than anybody else, we can assume one of 2 things. Either the U.S. system, the only non-nationalized healthcare system in the advanced world, is superior to the nationalized versions, or we can assume that the high cost of U.S. healthcare, about 15% of GDP rather than 10% that is normal in Europe and Canada, is paying off. Or it could be a mixture of both. Either way, we can conclude that the best way for the U.S. to cut healthcare spending and simultaneously increase its life expectancy would be to reduce its obesity, not nationalize healthcare. There is a number of ways that can be worked on, but it's not the topic of this video, so I will leave it at that. Now let's look at the costs of the already nationalized U.S. healthcare system and see if they provide the U.S. any significant cost reductions. The areas for us to look over include Medicare and the Massachusetts Universal Healthcare System. First, the universal healthcare system in Massachusetts. To start off with, we should look at what this plan has garnished for the good people of Massachusetts. Its purpose was to eliminate the population of Massachusetts citizens without health insurance. Unfortunately, out of the 10.4% of residents who were without insurance, 5.4% still don't have insurance, according to a door-to-door survey by the Census Bureau in March of 2008. So the system provided slightly less than half of what it promised. Now let's take a look at what it costs to maintain this healthcare system in Massachusetts. According to the Cato Institute, initially the universal healthcare supporters went so far as to suggest that the reforms would reduce the price of individual insurance policies by 25 to 40%. In reality, since the program became law, insurance premiums have been increasing by 10 to 12% per year, nearly double the national average. On average, health insurance costs $16,897 a year for a family of 4 in Massachusetts, compared to $12,700 a year nationally. Meanwhile, total health care spending in the state has increased by 28%. So in other words, Massachusetts got about half of what it bargained for at about twice the cost. This is not something that it would be advisable to extend nationwide. If we take just a glance at the exploding cost of Medicare, things look even worse for nationalized medicine. The following are several Medicare statistics that frankly scare the living daylights out of me.